website as are our previous webinars. At the end of the presentation today, we will be taking questions, so please feel free to use the Q&A section. It'll be a little button at the bottom of your screen there that you can submit questions, and submit them anytime throughout the webinar. If there's something specific that makes sense, we'll handle the question in real time, but otherwise we will get to those questions at the end of the presentation today. I am very pleased to be joined today by Dr. Astrid Galvez Forza. I am saying that awfully. I apologize. If you could please introduce yourself to our participants.
Sure. Thank you so much for this opportunity and welcome everybody to this seminar, Dentistry 101. It's really exciting for me to be here. Just to briefly let you know, you can call me Dr. Astrid. That's a pretty friendly way of approaching me. My origins, I'm Venezuelan. I'm a Venezuelan dentist. I am certified here in Canada. So it's been a few years, and I do see patients of all ages and of all backgrounds. And I've been serving patients in different languages as well. I have the good luck of being able to speak Spanish, Italian, French, and English. And I've been developing my professional career around preventive and comprehensive dentistry. So I've had studies in public health and dental hygiene as well. And currently I offer general dental services in Mississauga for all that's general dentistry, caries repair, cleanings, bondings, night guards, all these things that you're familiar with sometimes. And then also I do some specialty treatments such as Invisalign, and also extraction of wisdom teeth, crowns, bridges, dentures, you name it. So also implants and full mouth makeovers. So if you ever need to reach out to me or want to consult anything, I leave you there my email. It's drastrid.ca@gmail.com. And you can reach out to me anytime if you need any expert opinion, if you need to consult what we're discussing today, I'm available to you.
Thank you, Dr. Astrid. When we talk about dental claims, these types of claims really cover both tort and SABS issues and have two common elements between them. And those are causation and the reasonableness of treatment. So regardless of which side you're adjusting the matter on, we're going to discuss in today's seminar general dental anatomy, Dentistry 101, what records you might require in order to assess these two issues, the sections of the SABs that provide entitlement for dental services, how tort files might be protected under the SABs coverage, and then we're going to run through a scenario and get Dr. Astrid to give us some feedback on key issues. So Dr. Astrid, if you can get us started with our crash course in dental anatomy.
Sure. I hope I don't go too fast. If you have questions, you can then surely write them down for me. I'll try to make it simple. So let's begin with the inside of the mouth. In this slide, we see the breakdown of a tooth. This one in particular is a molar, also known as a back tooth. But all teeth, regardless of their location in your mouth, have the same basics. They have a crown, a neck, and a root. The crown is the part of the tooth we see, and then the root is embedded in the bone. The root or roots are only visible through special imaging, such as X-rays. And then the front teeth have one root, and the middle and back teeth usually have more than one root. All teeth, regardless of where they're located, they all have a tissue covering called the enamel. And this is a translucent tissue, and it shines light. So it's what makes pretty much the tooth shiny. Underneath, we find the dentin, that is the bulk of the tooth. The dentin gives the teeth their color. For some, it's more yellow, for some, it's some more gray. And then we have inside the core of the tooth, or what I call the heart of the tooth, that it is the pulp cavity, and then it's root canal. And these both house the nerves and blood vessels that pretty much nourish the dentin, the tooth. And root canal therapy, or like RCT, is when this area is actually cleaned and filled to eliminate any form of infection, just to quote that. Because the socket of the tooth is made up of bone, the root also has an outside layer called the cementum that bonds itself with the socket by a ligament, which is called the periodontal ligament. And finally, the bone is covered by the gum tissue. Moving to the outside of the mouth, we find that the top teeth are located in the upper jaw, known as the maxilla, and are innervated by the maxillary nerve. And the lower teeth are located in the lower jaw, also known as the mandible, and are innervated by the mandibular nerve. Now, the mandible is connected to the face by a bilateral joint that is called the temporomandibular joint. That's also known by everyone as TMJ. And it is called this way because joints in the body bear the name of like the joining bones. So in this case, it's the temporal bone behind the maxilla that does this joining. And it's the same bone that we know for like the temples, which are sides of our head. So an interesting fact about the TMJ, just to make this full here, is that if one side gets affected, okay, then the other side will be affected as well. So let's say there's displacement or injury, usually the other side tends to be affected. And the next, this one.
I think Dr. Astrid has frozen. We'll give her a moment here and see if her connection comes back.
We can move on to the, am I back? Is the connection back?
There we go.
Is the connection back? Yeah, where did
Yes.
I leave off? Sorry.
So we're just starting on the odontogram.
Is how we label the teeth in the mouth. So I was going to mention that the way this is laid out is called the FDI tooth numbering system. It is used in Ontario and Canada in general. So the reason why I mention this is because there are other systems that are not relevant to you right now. So let's just go by this one. So we divide the mouth in 4 quadrants, and the 4 are the same. So the upper right is quadrant 1. The upper left is quadrant 2. Lower left would be quadrant 3, and right lower would be quadrant 4. And each one has 8 teeth, so that would make them 32 teeth. And we start each quadrant with like 2 incisors. One is the central and one's the lateral, so it'll be tooth 1 and 2. Then we have the canine or cuspid, which is number 3. We have 2 premolars or bicuspids. It's first and second premolar, or first and second bicuspid. And we have, that would be teeth 4 and 5. And then we have the molars, number 6 and number 7. And then there's also number 8, which is also known as a wisdom tooth, or their lay terms called the 8s. And the first number would indicate the quadrant of where the tooth is located, and then the second number is what is shown. It's if it's central or the molar for second molar, and so on. Okay. So moving on to the next slide, we find that regarding patient records, as dentists, we tend to store the information in a clinical chart. And this chart contains a file called the odontogram. So the odontogram shows the teeth that are present in the mouth, which is teeth are also called hard tissue. And then the gum health of this mouth, which is also included, and it's called also the periodontal charting. We also make notes at every visit. We explain patient concerns, teeth conditions. We write the updates and the procedures that we perform. So all this is called progress notes or record of care. Then we have the financials. What the fees that have been paid, what's been submitted to the benefit plan, and any other pending payments. That is all included in the ledger. And then we also have the patient's medical history, along with medications, their health status, any other remarks that are relevant to the case. And finally, we have, well, in addition to all of these, we also include images such as radiographs, known as X-rays, pictures, CT scans, any digital scans or models that may be relevant for the patient.
Great. So when we talk about dental claims under the SABs is under section 24 provides a opportunity for claimants to submit an OCF6 if they have pre-existing dentures or dental devices that were damaged in the accident. That generally, when you're looking at these types of things, is that you would be looking to get a copy of those records to confirm that the claimant did indeed have a pre-existing denture. It might be when they talk about dental devices, those might be things like an orthodontic appliance or a retainer of some sort. Uh, Generally, those are removable type devices in a patient's mouth. Under Section 15 of the SABs allows claimants to submit treatment plans for injuries sustained in the accident and treatment thereof. And you'll see under Section 15A specifically, it refers to dental, and under 15E to dentures and other dental devices. Both of these sections would be accessed, or sorry, Section 15 would be accessed by submitting a treatment plan. And we see under Section 38 of the SABs that treatment plans for dental services need to be submitted in a form approved by the Ontario Dental Association. So a lot of times, at least what we're seeing come in on the files that we're getting are dentists who are just submitting sort of a basic treatment plan. They're submitting a typed up form of some kind that doesn't include all of the information that you as a assessor would or an adjuster on the file would want in order to look at the reasonableness of the treatment proposed. So I would say both SABs and tort adjusters should both be insisting that the form be the one approved by the Ontario Dental Association. And that form looks like this. This is a standard form. We see a place there for the name of the claimant, the name of the dentist, a place for notes to be added, written notes to be added. And then here in the main body of this form, where we see all of these little boxes, is where all of the information would be added. So the procedure code, the tooth number, what we just talked about, tooth services, what the fee is, dentist fee is, if there's a laboratory fee, meaning they're sending that out to a third party in order to be fabricated before placing into a patient's mouth, the total charges, and there is specifically a box down here that says, is the treatment required as the result of an accident? And if yes, provide details separately. So rarely do we see that kind of information coming in on the claims that are being submitted. But it's something really that you can insist on in order to allow you to properly assess these claims. The only difference between this form and a dental claim form is that on a predetermination or on a proposed treatment is they won't fill out the date. versus if they had submitted this same form to, say, a third-party insurer, Manulife, et cetera, that provide dental services, that this claimant has dental coverage under, then they may have already done the treatment and there would be a date in there, and really they're just sending it on to you as the next insurer in line. Each year, the Ontario Dental Association does uh, publish a fee guide. It's not published publicly, but it is provided to all dentists in the province, and some of the libraries around the province do have a copy that individuals can access, but generally uh, it's not widely distributed. However, the fee guide itself is a suggested fee guide. Dentists are not obligated to follow this fee guide, but they are obligated to inform patients if they do intend to charge above the fee guide. Um, Dr. Astrid, I'm going to get you to jump in here and tell me, what's your experience in regards to dentists following this suggested fee guide, and how it comes about?
Well, based on data for the Ontario Dental Association, we would say that pretty much 90% of the province dentists do follow the ODA fee guide. However, there's always some doctors that for certain specific procedures out of expertise or however they feel that their job is or their procedures are valued, they might change slightly these fees. They might increase the standard, or some of them may prefer to provide some courtesy credits to specific group of population. For example, seniors get 10% off from the standard fee guide, or probably specific children, things like that. But most of the doctors would follow the OE fee guide. Uh, Also because when we elaborate treatment plans, we want to make sure that it's in line with their benefits or whatever special plans they have. So most of the doctors would want to keep like a standard for this.
So, how is this fee guide developed?
So it is developed, a group of dentists gather once a year to analyze what the expenses are, what the overhead of an office, how much it costs for a certain procedure to be performed, how much time it takes to do. And so they get a national average. And most of the time they compare themselves with all the other doctors that do the same thing. They come together and they make an average. And with this average, they establish the new fees. So, for example, last year we were all hit with the pandemic, and fees unfortunately had to go up because each procedure would require more care or more steps to be able to be completed. So, as you cannot really tell somebody to pay separate for your very, very specific fees, it's all embedded into what the procedure entails.
Great.
A
So
certain
we're going to move on to our scenario. So here's the scenario. On Friday, March 20th, 2018, a 50-year-old male, not at fault driver, was involved in a motor vehicle collision where he T-bones a left-turning vehicle. The driver claims he fractured tooth 4.3 and 4.4 in the collision, and when he struck his lower teeth on the steering wheel. 6 months post-accident, the driver obtained a treatment plan for 2 implants on those teeth, along with an osseous allograft, which is a bone graft. There is a pre-existing partial denture replacing 3 of the upper teeth, and the last pre-accident visit was 3 years prior. And this driver was taking beta blockers at the time of the accident. So, what issues in regards to causation, or what injuries would you expect to see? Uh, give us your take on this particular scenario.
Well, first of all, we would have to see if there's any soft tissue trauma, what reports we got from the hospital or first care this person had. to ensure that it does match with what the patient is bringing up to inquire for treatment. Um, if they're mentioning that the patient fractured two teeth and seeks for care 6 months later, could probably show you that these teeth may or may not be in need for urgent care or to be extracted. So usually what we would want to look for also is how committed is this person to their teeth and their oral health. We can see that the person was not very diligent in showing up for their annual dental visits, as well as having a previous partial denture shows you that probably their teeth were not something very, very important to them. Also, the fact that they have the partial denture also shows that probably implants is not something they're willing to consider. Now that they might get some funding from a benefit plan or insurance, they might consider that option. So we would certainly need to see also what the patient was taking as medical. Beta blockers are not considered to be um, medications that can cause mouth issues from an accident, like well-known dry mouth and things of the kind. So what we have to do is analyze if these teeth really need to be extracted and if implants are a good choice for them, and if bone graft is really necessary. Probably options like a bridge or a crown could be also provided, and they're not as costly as probably implants with graft.
Okay. So, how would one look at or decide if there was sufficient bone, you mentioned there, in order to do an implant?
So what you would do is you would reach out to the last doctor that saw this patient and try to retrieve as many records as you can. As I mentioned before, you would want to look at the odontogram, you would want to look at any previous x-rays or any data of this kind. What you want to know is to know if you have enough bone, you would need a 3D image. And this is called a CT scan or CBCT. It's a new technology that actually lets you see the tooth on a from all angles. So you would be able to know if there's enough bone for this person to qualify for an dental implant. And even if bone graft is an option, sometimes some patients might not qualify based on their medical history or probably their possibility of rejecting this graft. So there's a lot of things to consider, and I would really pretty much say to get all these records and this CBCT scan or CT scan in order to properly assess the area and make sure it's proper for what they're recommending.
Okay. I see a question has come in on our Q&A in regards to, where would a handling adjuster find out who this patient was seeing pre-accident? Um, and I think the question or the answer to that is that when we talked about the records earlier, uh, one of the records or one of the potential options there is that if they submitted a treatment plan that indicates they have coverage under a collateral provider, then that's probably the first place you're going to go, is that the collateral provider, just like they keep track of, how much physio somebody obtained pre-accident and how many massage therapy sessions they go to, etc., that they would have records in regards to the individual's pre-accident dental. You may require an EUO if the individual is not forthcoming in terms of providing names or sources of pre-existing dental records. Unfortunately, there is no central database available as there is with, say, an OHIP summary. But so those are the two places. The other thing to keep in mind in our scenario here is, although there are some causation issues that can be addressed in the dental realm, what sort of damage you would expect to see in someone's mouth in regards to striking their teeth on the steering wheel. But there's probably an engineering question there that will need to be answered as well as was it possible? What certain factors would have to be present in order for that to happen? So there, there are two potential avenues on that part of it. I see another question coming in here is, can you tell us, Dr. Astrid, what is involved in placing an implant?
Sure. So an implant basically, as I showed you in that first slide, that the tooth has a crown and it has a root. When we lose the whole tooth, we want to replace the roots in order for us to build up on top of it the crown. So a root, a fake root, it's the part that we call the implant. And to place an implant, we would have to basically select the type that we want to put in. Usually what's out there in the market, it's titanium based. It's a metal and it's the most compatible metal for the body. What it entails is just to drill through the to be able to screw this implant in. And then what happens is that we usually plan 2 stages, which is the surgery, which is what I'm explaining now. And then you're going to wait 3 months to make sure that this implant integrates to the body, to the bone. So that's called the osseointegration stage. After 3 months, the person who placed the implant, which can be a general dentist trained to do this or a specialist, would assess if in 3 months there has been this integration. If there isn't, then that means that the patient has rejected the implant. If the patient successfully had this osseo integration, then you can proceed to the second stage, which would be the restoring of the dental implant. This can be done by the same general dentist doing the case or a second provider, which would be a specialist in placing this crown on top of the root that it was just surgical.
Okay, and I see
what it entails.
Oh, sorry.
I lost you for a second. No, I'm just, it takes a process of 1 day, 2 months to complete.
Okay. So I see another question coming in here about post-accident medications. So are there any post-accident medications that would have, I guess, an extreme effect on someone's dental health?
Well, top of mind, extreme for like in this case scenario, no, but probably painkillers or things like that. We would be looking at regular painkillers don't, but if they are taking anything related to nerve damage or depression or probably anti-anxiety medications, they can dry them out.
And how long would you?
Those could be affect the flow of saliva in the patient's mouth.
So how long would you expect before those types of side effects would have any effect on their dental health? Like if a claimant was on those medications, let's say for 6 months, would there be any significant change?
Well, significant change you will start seeing after at least 3 months, like full mouth cavities or full mouth gum health getting worse. But it usually doesn't happen right away from a day to the next. That's for sure. But it is very important that this person, right after the trauma and the accident, follows up with their medical doctor. So usually you can always contact their medical doctor to follow up and see exactly what they're taking and how long they need to take it for.
Okay. So we are pretty much out of time here. We do have some upcoming webinars. July 20th, we have Watch Your Words, Misrepresentation Under the SABs. And August 11th, Can We Settle Your Claim? Negotiation Tips for Adjusters. If you have any questions about today's presentation or you'd like a copy of the slides, you're welcome to contact me. Obviously, if you have dental specific questions, you're welcome to contact Dr. Astrid. We thank you for participating with us today and hope everyone has a great afternoon.
Thank you. Have a good day.